roti, kapda or makan. These three bare necessities for survival have for long been on India's Aam Aadmi agenda. But one of the most important needs after these basics is also preservation of health. Only 60% of India's population has access to doctors and drugs. For a vast majority of that population, the cost of that healthcare is crippling. India today not only suffers from poor standards of service, but even disparities in those services. The challenge then, perhaps, is not only to cover every citizen, but also to narrow the inequalities in our healthcare coverage. Kiran Mazumdar-Shaw, one of the leading names in India's healthcare sector, has been meeting with the best minds to tap into their rich experience to find solutions to build a national healthcare system. And today, she meets a very special guest.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My guest today is Dr. Srinath Reddy, the head of the recently formed Public Health Foundation of India. Over the next 30 minutes, Dr. Srinath Reddy will discuss what the PHFI is going to be doing in terms of developing a roadmap for India's healthcare system. Dr. Srinath Reddy, thank you so much for coming on this very, very interesting program. Let me, start by, sharing with you some of the big challenges which you are very well aware of in addressing our healthcare issues in the country. Let's start with just physical infrastructure, where we know that we need to create 2 million more hospital beds, and we know that it is going to cost us $80 billion over the next 5 years to close this gap. We also know that we are today spending 1% of our GDP on healthcare, whereas we need to really ramp this up to almost above 5% for sure, but closer to 10%. What are some of the things that you are addressing in the Public Health Foundation of India?
Firstly, the Public Health Foundation of India was set up to try and address one major area of deficiency in our health system, that is the lack of public health expertise at various levels. Given that public health is not only dealing with the determinants of health and disease, but also with how the health system must be configured to function in an efficient and equitable manner, the Public Health Foundation's mandate is indeed very wide. Apart from the traditional programs like training people in public health through diplomas, masters and PhD, we are also engaging with health services across the country in a large number of states to try and train existing functionaries in delivering public health much better. So we are actually building capacity at multiple levels and also enabling policy and programs through relevant research, by filling in critical information gaps through research, by evaluating the functioning of programs and trying to suggest where they could have corrections or where they should be scaled up, and also trying to reach out through health communication to the wider mass of the public so that they too can become participants in the healthcare system.
In my various conversations with people who are stakeholders in healthcare, many ideas have been thrown up, one of them being that there needs to be a good role play between the private sector and the public sector. For instance, we know today that 60% of our hospitals are in the private sector, 50% of our hospital beds are in the private sector, and yet we know that we need to create a very affordable healthcare model that is inclusive. And we know that there is a perception that if the private sector gets hold of healthcare, then that affordability factor will be compromised. So, we need to address that. You and I have talked about the fact that there needs to be a good model of, accreditation, accountability, auditing, and price, control, to use the crude word. But what are your thoughts on this front?
Well, we must recognize that there is a need to engage constructively all the sectors that are presently now contributing to healthcare in India. So what we really require is a greater outreach of primary and secondary healthcare services, particularly through a public sector, which has to be more resourceful and responsive to the issues of access and equity. At the same time, we need the private sector, which is present, but which is also mostly urban aggregated, to not only spread out so that it also contributes meaningfully to primary and secondary health care, but also to become more responsible in terms of the cost of health care that it is providing. So we need an appropriate framework which can draw the contributions from each of these sectors, commensurate with their strengths, but also build in a regulatory framework so that quality and access both can be ensured, and of course affordability becomes a major consideration too.
You know, we know today that our primary and secondary health institutions in the public sector, so to speak, are performing at 30% of their potential, because either they are under-resourced to that extent or they are not equipped to that extent. So they are in some way not delivering good quality healthcare in any form in terms of what you described. So one of the suggestions was, can private sector come in and provide those extra resources and then do this on a profit share basis with the government, where the government plows back its share of the profit in the healthcare system, so that you can actually make it into a self-sustaining kind of business, and that tertiary care be really left to the private sector, because there we believe that you need to create large health cities that will be able to deliver affordability, largely because of the fact that you have these huge numbers that will bring down costs. Added to this, of course, when we talk about affordability, I think we are also talking about efficiency. So the use of IT becomes very, very important in driving efficiency into the system. What are your thoughts on that?
Certainly IT is going to be a very, very important enabler, and we ought to use it appropriately in order to increase the outreach of services. IT is not only to facilitate telehealth or mobile telephony for health, which will enable healthcare providers at the front lines to feedback information to other levels which are more distant, but we also ought to be able to use the information technology much more creatively in order to empower the individuals and the communities. Because we must recognize there is a huge asymmetry of information and asymmetry of decision-making power in health. In fact, that's one of the reasons why there is a bit of a market failure in health. In fact, it is the supplier who sets the demand for health. Now, if we can actually move the supply also to the people who are actually creating who really are setting the demand, that's the people, give them a lot more health information so that they can actually not only become aware of their clinical conditions and how to prevent them, but also actually do self-care to a substantial extent. But back to your question about private sector participation at various levels. Clearly, the private sector can and should contribute to primary and secondary healthcare services as well. As far as tertiary care is concerned, while the private sector presence is important, I wouldn't leave it entirely to the private sector. You need public sector presence at all levels, including at tertiary care, because you require benchmarking. Benchmarking both for quality and for cost. Clearly, we need standards of care which are applicable both to public and private sector. Now, we therefore require also a regulatory framework for all levels of care. We need clinical guidelines which are set by professional experts, and we need technical audits and social audits.